strain of the disease. Other STDs like HIV and AIDS, genital herpes, and human papillomavirus cannot be killed by medicine. We can sometimes treat their symptoms, but we can't cure the diseases. Once you catch one, it's yours for life. In the case of HIV and AIDS, the disease will most likely eventually kill you. In the case of human papillomavirus, it may lead to cervical cancer, which kills about 5,000 women each year. Genital herpes may not kill you, but it may end up killing your newborn child. When I said earlier that what I'm going to tell you might save your life, I literally wasn't kidding.
So if a person practices safe sex, they be safe, right?
Even though that's what everybody thought, if you're talking about using a condom, it's still not safe. My colleague, Dr. Marilyn Billingsley, who is Associate Professor of Internal Medicine and Pediatrics at St. Louis University and treats kids in large cities, will tell you the same thing I will. Condoms are not as safe as we thought.
I see teens almost every day that are infected and yet thought condoms would protect them. In fact, in the last 20 years, condom use amongst teens has actually grown from 21 to 67%. And the number of pregnancies have gone down. But during that same time, the increase of sexually transmitted diseases has gone through the roof, which means that condom use has not stopped STDs. In fact, in the last year, the National Institute of Health has stated that condoms at best reduce the risk of HIV and gonorrhea in men, but for all other STDs, there is insufficient evidence that condoms reduce the risk at all. And that means much less protection for women, because some STDs are spread through genital skin contact, and condoms do not cover the entire genital region. So unfortunately, according to the latest research, and I'll also add the experience of many doctors like myself, safe sex isn't safe.
I have a bunch of friends that are having oral sex and they think it's okay because they won't get pregnant and they'll still remain a virgin, so isn't it safe?
First of all, oral sex is sex. The problem is any STD you can catch from vaginal intercourse, you can catch through oral sex as well, because oral sex includes the exchange of body fluids and skin touching skin. This is what diseases need to infect you. In fact, sore throat, fever, and swollen lymph nodes from gonorrhea are increasingly common in middle school kids today. Even recent outbreaks of highly contagious syphilis, which can produce painless ulcers, and later complications including rash, heart disease, memory loss, and death, have now been traced to oral sex. Herpes and other STDs have also been associated with oral sex. So oral sex is not safe sex either. The other thing that concerns me is most teenage girl patients of mine are not performing oral sex because they want to, but because their boyfriends or guys they know want them to. In fact, in most cases, the girls may not like it, but they continue doing it to keep their boyfriends or just to fit in. If that's the case, then that's not sexual freedom. That's sexual manipulation.
So how do you have safe sex?
You may not want to hear this, but it's the only answer I can give from a medical perspective. Postpone sexual activity until you're married. You might be saying, are you going to ruin all our fun? No, I'm trying to preserve it. It's not fun if you end up catching a disease and it ends up ruining your life or your family's life. That's what I'm trying to keep from happening. There's another side to this discussion that you might not have considered, the emotional side of teenage sex.
My name's Paul Warren and I am a psychiatrist in Dallas, Texas. Researchers in my profession have discovered in their most recent studies that there's a cause and effect relationship between teenage sexual activity and depression. Now, depression is such a serious problem that suicide is now the third leading cause of death among teenagers. According to this most current research, an astounding 33% of all teenagers have experienced enough depression that they've contemplated suicide. A recent government study showed that sexually active boys are twice as likely and sexually active girls 3 times as likely to be depressed as compared to other teenagers who are not sexually active. If a girl is sexually active, she is 3 times more likely to attempt suicide. For sexually active boys, they are 8 times more likely to attempt suicide. The teenage years are supposed to be years of hope and optimism, not years of despair and hopelessness. Dr. Armand Nicolai, a psychiatrist, author, and professor at Harvard Medical School, who has done extensive work with older teens and college-age adults, has concluded, and I quote, "Sexual permissiveness has not led to greater pleasure, freedom and openness, more meaningful relationships between the sexes, or even an exhilarating relief from stifling inhibitions, but," and I continue to quote, "has often led to empty relationships, feelings of self-contempt and worthlessness." He's not alone in those conclusions. I've noticed this in my practice as well. Depression in teenagers is all about loss. And with sexual activity, there is a loss of virginity, a loss of control, a loss of self-esteem, and even a loss of trust in your partner and even yourself. And it becomes a vicious cycle. If I'm feeling depressed, I have sex. But when I have sex, it makes me more depressed. And so on it goes. Many teens tell me that after several sexual partners, they just don't care about themselves much anymore. They feel empty, lonely, and dislike themselves because what they wanted from sex never happened. Sure, it gave them a quick buzz, a good feeling, but afterward, the pain moved in. Our hope is that we can keep you from having to experience that kind of pain.
So if a guy's never had sex and his girlfriend says that she's never had sex, are they going to be safe?
First of all, you need to determine whether for convenience sake they're telling you the truth or not. Unfortunately, people will say a lot of things in order to get what they want. From a medical standpoint, it's as simple as this. If you only have sex with one person and it's the same for your partner, you can't catch an STD. But if you have more than one partner, because so many teenagers and young adults are infected, you run a very significant risk of becoming infected as well.